What are common misconceptions like or stereotypes surrounding eating disorders?
How much time do you have?
Yeah. Hey, we have time.
So I think the biggest one is that it's a look, that you can look at someone and say, like, you have an eating disorder or you don't. And a lot of this comes from sometimes what's referred to as like a S.W.A.G myth. So the skinny white affluent girl. And if you happen to be that person and you happen to be seen by your physician or people in your life notice, oof, you look like someone who we might think has an eating disorder. And that's, when I'm doing training, even with counselors, with family health teams, that's often an exercise that I do with them, is saying, you have a brand new referral. The only thing you really have about your new patient is, concerns about eating, or like that we're looking at an eating disorder diagnosis. You're walking out of the waiting room, who do you see? And so often, even really experienced folks kind of squirm in their chairs and go like, I know this isn't what I'm supposed to say, but this is what comes to mind. It's like, well, yeah, and that's no one's fault, right? There's been a lot of that pushed in the media, and even a lot of the research and stuff that we have on eating disorder assessment and treatment comes from typically straight women and straight white women. And so we're saying like that needs to change in and of itself to have more diverse and more inclusive views of how these things present and how we actually approach them.
So how can we do that? Talk about it?
Yeah. And I think that's the other thing, right? That sometimes in terms of those myths that like, well, if people are experiencing an eating disorder, they're really going to be showing off their body, but this is going to be something that they're kind of leading with. And like, actually, eating disorders really do kind of thrive more like in private. People actually often have a lot of guilt and shame about what's going on for them.
So when the doors are closed, when you're alone, that's when you're like, okay, like I do not like what I'm seeing.
And so the talk about it is sort of saying like, can we get comfortable talking, with our own support systems about, hey, when am I struggling? When am I noticing I'm having more concerns about my body, or even beyond that, to be able to talk about like when we're just having a hard time, so we don't have to take it out on our bodies and go that route. I think also from the medical or healthcare side of things, we actually know from a lot of the research is that folks in kind of, again, real heavy air quotes, because there are a lot of problems with things like the body mass index.
Yeah.
But if someone's coming into a doctor's appointment and they fall into kind of a normal to overweight category, they're a lot less likely to be asked about eating disorders. Someone in a larger body, someone may go like, well, prescribing weight loss. Well, that's really, really tricky. Like we've already talked about, like that may really be entrenching a lot of really, really problematic stuff that's going on. And so to be thinking, can we standardize things? So we are asking all clients, what is your relationship with food like? What's a general day of eating looking like for you? And how are you feeling with that? Because that also feeds into a myth I think that clients have themselves of thinking like, well, I don't look like someone who's very thin or who's emaciated, so this wouldn't be something for me to bring up. We've certainly had, more clients than I can count on my hands come back and say like, I tried to talk to my doctor about this, and they said like, well, you look okay. We're saying, well, yes, but that may be true. And even for some people, we're saying actually their blood work, their labs look totally fine. And we've rendered a diagnosis of an eating disorder in a pretty severe range. Our bodies can do really cool things. So sometimes they can go through a lot, and our blood work can look normal. Outwardly, they can kind of look normal until they don't.
What are the red flags?
I think if you see, especially like really quick changes in, rapid weight loss in somebody, or even just big changes in terms of like eating behaviors. All of a sudden, are we cutting out major food groups? Is there a lot more preoccupation about like, I can't eat this, I can't eat that? Provided they haven't been giving sort of like a medical diagnosis of like, actually you have an allergy, or you, for other health reasons, really need to be changing this stuff up. But those changes from like, we know the people in our lives, if there's something that dramatically changes, if people are becoming a lot more maybe kind of withdrawn, I don't want to go places, they don't want to see people, a lot more concern about their body, even body checking behaviors, someone spending like a lot more time in the mirror, oh, we need to kind of go get that like that smart scale and have it like middle of the bathroom and be using it every day. We want to really say, well, one, if we're already there, really start pulling those things back. But if you start to notice those as new behaviors, something to really check in on.
Kind of scared because you're kind of describing me.
Well, this is I think the other myth part that's maybe not so much the myths or misconceptions about eating disorders, but some of the myths and misconceptions about things that get thrown out there as normal or healthy or wellness behaviors for all of us.
Do you know what muscle dysmorphia is?
Yeah.
Can you explain it real quick for the viewers?
It's in some ways some kind of so it's not a diagnostic criteria yet that we would generally put this under more of a body dysmorphic disorder if it was the perception of the body alone and not kind of changing kind of eating and training and that kind of stuff. But it's really sort of saying almost the opposite, that we often think of someone experiencing something like anorexia of thinking, oh, I'm always too big. When we're looking at this in terms of kind of training and muscle dysphoria, often it's like, I'm not big enough, or this shape isn't right, and real preoccupation about there's something wrong with the overall size, shape of my body, or specific attributes that other people are saying like, I truly don't see it the way you see it.